Hello everyone, this is Dr. Shushma Saralla, consultant homeopath at Fidicus Homeopathy. Today we are going to discuss a topic called as dandruff. The reason why we are discussing dandruff is that it is not a serious health issue, yes, but it is surely of concern. Do you know that globally 50% of people are suffering from dandruff? Remember, the amount of people, 50% globally, is a huge number. And not only that, the anti-dandruff shampoos have sales up to 80% increase, especially during winter seasons. So remember, if you have dandruff and you don't know what sort of dandruff you're suffering from, let's dive into the topic to know it in a better form. So what is this dandruff? Dandruff is nothing but it is scaly white grayish flakes that are developed in your scalp. If you can see the picture, you can see the grayish or white flaky scales which are on your scalp. Especially they are accompanied, most oftenly they are accompanied by itching. So what are the signs and symptoms of dandruff? The first sign and symptom of dandruff, everybody knows this, is flaking or production of white scales or grayish white scales on your scalp, which gives the appearance of a powder or a powdery appearance on the hair. Next one is redness or itching. See, not every person who is suffering from dandruff will suffer from itching or will have redness. But remember, up to 80% cases show itching and up to 60% cases show redness in the scalp region. As you can see here, the redness is not very profound, it is very light pinkish in color. But remember, if you're having areas of redness, that means you will be having areas of tenderness as well. That means whenever you're touching your scalp with your hand or you're combing, if you have red area in that, red area on your scalp, whenever you're combing or whenever you're touching, whenever you're oiling your scalp, you will feel a little bit of tenderness and some people feel a little bit of pain during the process. And not only that, if you have dandruff, the other symptoms will be, see, not all dandruffs are dry, not all dandruffs are oily. Some people will tell you to have oil on your scalp, some people will tell you do not oil your scalp. There are different types of dandruff and different types of treatment for each type of dandruff. So in dry dandruff, we will be having scales which are dry and flaky, but in oily, there is a different condition. So in oily dandruff, you will be having greasy scales on your scalp, okay? But in dry dandruff, you will be having a powdery look, whereas in oily dandruff, you will be having greasy scales. Whenever you're having greasy scales, remember that the oil production is more. So whenever you touch your hair, it will be a little bit oily, and oily scales or oily dandruff will be more prone to redness and itching rather than dry one. Dry one will have more of breaking in the skin, little bit of minor breaks or cuts can be found in the skin if it is severe. But the oily dandruff will be having greasiness. You will be having something called as weeping. So what is weeping? Weeping is not shedding of tears, but in dandruff, weeping is something when there is a over exfoliation of the scalp. Whenever you touch that part or whenever you touch the over exfoliated part, it will be red, it will be tender, and it can ooze a little bit of serous fluid. So that is called as weeping. Some fluid will be coming out from that area if you pick that flake. So that is called as weeping. So what are the signs and symptoms of dandruff? Dandruff has itching, it has redness, it has flakes which are grayish or whitish in color, it has tenderness, and not only that, it is greasy as well, and also it will have a weeping tendency or a little bit of fluid, serous fluid oozing from the flakes. Now let's dive into the investigations part. There are two types of investigations, physical investigation and scalp biopsy. Not everyone who is suffering from dandruff needs scalp biopsy. So first let's know what are the things that need to be taken into consideration during physical examination which will lead into the scalp biopsy. First, if you are doing a physical examination, the doctor will look into your scalp. They will consider how far or how extensive the flakes are, how thick they are, how greasy or dry your skin is, if it has severe cracks or minor cracks on your skin or your scalp, and also if it has any yellowish scaling. See, yellowish scaling represents fungal or yeast-like dandruff. So they will take into consideration all of this, and not only that, they'll not only examine your scalp, they will examine the area around it, that is your forehead and your zygomatic area as well as your neck, the higher part of your neck as well. So why do they examine all this? Remember, there is acne because of yeast, which is caused if you have severe dandruff. If you have severe dandruff because of the fungus or the yeast infections, that flaking will fall on your forehead, on your ears, and on the lower part, on your shoulders as well, which will cause tinier bumps on your skin. These tinier bumps are very itchy. So if you're suffering from tinier bumps on your forehead or on your neck or on your shoulder and they're very itchy, do check if you have dandruff and examine the flake. If it is white in color, maybe that is not much of concern, but if it is yellowing in color or yellowish in color, maybe it is of yeast infection. Next, scalp biopsy. For example, if you're suffering from a deeper infection or a deeper disease like psoriasis or eczema, which is present anywhere other in your body, it can also affect your hair or your scalp. So in these cases, you will be needing a scalp biopsy to understand what sort of infection or what sort of disease or what sort of autoimmune disease you're going through. Now let's get into the structure and functional part of the scalp. First, let's discuss the structure or the anatomical part of scalp. As you can see here, the skin or the scalp is made up of 5 layers. The primary part is the skin. The secondary one is the connective tissue, the aponeurotic tissue, loose areolar tissue, and the pericranium. So in this skin, again, we will be having the epidermis part, the dermis part, and the hypodermis part. Okay. So remember, whenever we are talking about dandruff, we are talking about this part. That is the skin part on the scalp. Okay, and not about the connective tissue or the aponeurotic tissue or the pericranium. Now let's dive into the functional part of scalp. See, as I told you, the skin will contain hair follicles or hair. Every hair follicle will have an immune system or a micro immune system of their own. And also, whenever this epidermis which is present is disrupted, then the pathology part or the dandruff will start to appear. As long as the epidermis is intact, it is not irritated, then there is no pathology running. So what are the functions that this scalp does? Main thing that the scalp does is protection. It will protect your skull from the external environment. And what is the second thing? It does thermoregulation. What is thermoregulation? It is nothing but it will protect heat or it will trap heat whenever the outside environment is very cold, and also it will sweat whenever the body temperature is increasing. That is thermoregulation. And mainly it helps in hair growth as well. And also it has blood circulation. Blood vessels in the scalp are directly connected to the venous sinuses in the skull, as well as it has nervous innervation, so that whenever you're massaging or whenever you have sensations on your scalp because of the nervous innervation. So today what we are going to discuss is, we're not going to discuss all of these topics. We are going to discuss about this hair part of the scalp because we are discussing dandruff. Now let's discuss the risk factors for dandruff. Yeah, age factor. So what sort of age criteria falls into place when we are discussing about dandruff? Remember that the moment you feel you have dandruff, you're either in your adult age or in your teenage. So dandruff starts from teenage in certain section of people, but usually the higher presentation or the predominant presentation is usually from 25 till 45. It is not that people who are in 60s or 70s or 80s do not suffer from dandruff. It is genetic in nature, but mostly the section who are suffering globally are from 25 to 45. Being male, males are usually more predisposed to suffer from dandruff rather than females. Certain illnesses is like Parkinson's disease, HIV, also have this severe exfoliation of the epithelium because of the immune dysfunction, leading into severe cases of dandruff. So next time if you're suffering from dandruff, see if you have any of these internal issues, like if you have Parkinson's, or if you have HIV, or if you have psoriasis or eczema, if there is any other systemic representation, just not the epithelial exfoliation or just not flakes, but internally also if you're suffering, that can also represent, or it can have an external representation like dandruff. Next, let's dive into the causes of dandruff. Irritated or an oily skin. So what is irritation and what is oily skin? Remember that whenever you're using different hair products, for example, you're moving from one place to another continuously, or you're traveling, your hair is exposed to different sort of water compositions. It can be hard water, it can be soft water. So that difference also causes or irritates your scalp or the skin. Remember that there is skin layer on the scalp that is also sensitive. It is highly absorbent as much as this skin on your face or anywhere on your body, and also it gets irritated. And not only that, sometimes because of the stress or the lifestyle dysfunction, like not sleeping properly, having hormonal imbalance, can cause excessive sebum production. Same like that on your face, there can be excess oil production on your scalp, leading into oilier skin. Dry skin. When do you have dry skin? If you're using a lot of different kind of hair products which strip the natural oil from your scalp, then that can lead into dry skin. Next, fungus malacia. So what is this malacia? This fungus especially feeds on the oil or the sebum that is produced on your scalp. So this fungus is the main culprit when we are talking about oily kind of dandruff, which is fungus malacia. And then sensitivity to hair products. This can be because of contact dermatitis. For example, there are certain people who are so hypersensitive that even a soap can cause a rash or excessive peeling on their hand. Remember, you're using so many products. You're using styling products, heating products, hair serums, and then you're using hair mousse. A lot of these products. These can irritate your skin and cause contact dermatitis. Then why do we not know? The reason is that, see, this part is what is visible to you, to your eye. This is not visible to your eye. So you have to check or have an scalp examination at least once a week to see how your scalp is. If you don't understand your scalp, then it will be problem in choosing the hair product, or the product that you're choosing might not fit for you. Next, skin conditions like psoriasis and eczema. These are eczema and psoriasis. Psoriasis is an autoimmune disorder. So if you have psoriasis, then that can also affect the scalp, leading into scalp psoriasis. Next, coming into the vitamin deficiencies. These days, these cases are more. Zinc, vitamin B, and also very low levels of vitamin D can sometimes trigger or cause excessive epithelial exfoliation. So remember, if you're suffering from dandruff and you don't have all these above causes, you're using good hair products, your hormonal balance is proper, and but still you're suffering from dandruff, that might be that you have very low zinc level, very low vitamin B complex level, or very low vitamin D. Next, let's dive into the types of dandruff. Remember, there are so many YouTube channels, so many Instagram stories telling how they cure their dandruff. Remember, dandruff is not same for everyone, and there are types of dandruff that no one discusses. There are three types of dandruff. First one is your dry dandruff, then is your oily dandruff, and then is your malacia dandruff or the fungal dandruff. What is dry dandruff and what does it causes? As you can see, this part, if there is appearance of powder like appearance on your scalp or on your hair follicles, and also when you are rubbing your hair like this, or whenever you're correcting your hair, you feel that this powder is falling all over your shoulder or on your clothes or on your forehead, that may be because of dry dandruff. What are the causes of dry dandruff? Using excessive or hair products which strip the natural hair oil, and not only that, using a lot of anti-dandruff shampoos or shampoos which contain salicylic acid, and not only that, having climatic changes, like for example, if shifting from one place to another, you're having or you're bathing in hard water, then that can also cause dry dandruff. So dry dandruff is the scalp is really dry if you check, and also there is powdery appearance. The flakes are very smaller compared to oily dandruff. Then what is oily dandruff? In oily dandruff, you will see if you part your skin in the midsection and you touch it, you will have this oil or the sebum touching your skin. Not only that, the flakes compared to dry dandruff are very large. Dry dandruff has small powdery flakes, whereas oily dandruff has larger flakes that are attached to your skin. So whenever you're trying to peel it, some people try to peel it or some people try to comb it really hard, then that peeling can cause redness, irritation, tenderness, and pain. So this is oily dandruff. So why do you get oily dandruff? The reason is mainly it is because of the hormonal imbalance. This hormonal imbalance will cause excess sebum production on your scalp the same way it causes on your face, and that can lead into oily dandruff. Next, fungal or malacia dandruff. So what is this malacia dandruff? Remember, oily dandruff, if not checked properly or not taken care of can lead into fungal dandruff. So what happens in this fungal dandruff? There is a fungal yeast-like fungus called as Malassezia. Remember, on our skin or anywhere on the body, same like on the scalp, we have bacteria, we have P. acnes, we have Malassezia on the scalp. But not everyone is affected by Malassezia. So what are the conditions which lead into the fungal affections? We will be diving it in the pathological part. But remember, fungal dandruff always comes if the oily dandruff is not checked. As you can see, fungal dandruff is yellowish in discoloration, like it has yellowish hue to the flake. Okay, whereas dry, it is just like powder. Oily, it is oily and is always attached, usually attached to the scalp. And then, okay, this is psoriatic dandruff. It is just a manifestation of psoriasis which needs a medicine from inside out. Just by changing hair products, you cannot cure psoriatic dandruff. Next, coming into the body changes or the pathological part of the dandruff. So, here I'll explain it to you in detail in just 3 steps. Actually, what's happening in the hair follicle. If you see this picture, remember that the epithelium should always be intact. Primary thing. When will your epithelium be not intact? Because of the any other mentioned causes which I've already discussed in the video. That is excessive hair, excessive combing of hair when you have oily dandruff, hormone imbalance, using different kinds of products, traveling from different places, using different kinds of water to wash your scalp. All of these can lead into epithelial disruption. So remember, there is sebaceous gland which is secreting the sebum, and not only that, every hair follicle will have an immune system of the own. Body is designed in a way that every hair follicle will have a micro immune system. Okay, so whenever this epithelium is being disrupted or broken down, the yeast, the bacteria which are present usually on the scalp will get inside. Epithelial disruption, all of this will get inside. And this Malassezia yeast, what it does, it will feed on the sebum. And what it will do, it will over colonize. That means too much of production of Malassezia yeast or too much production of Staphylococcus bacteria or P. acnes bacteria. It will release pro-inflammatory mediators. What will the pro-inflammatory mediators do is that they will cause inflammation. And this inflammation, what it will do is it will cause too much of the epithelium to be produced or hyperproliferation of the epithelium. This hyperproliferation of the epithelium is what are the flakes that you see. Too much of excess production of the epithelium or the dead skin cells, that will lead into that flaky appearance on the skin. So remember that pathology of dandruff always starts from epithelial disruption, the pathogens getting inside, over proliferation of the pathogens, inflammation, and from inflammation, hyperproliferation of the epithelium leading into the flaky skin or the flaky scalp. So don't be too harsh on your scalp next time. Coming into the conventional treatment part. So the conventional treatment, we have 3 types of treatments. One is medicated shampoos which have zinc, selenium and coal tar. See, remember, these medicated shampoos help in clearing off the yeast or the bacteria, but they are not addressing the cause, which is epithelial disruption because of excessive hair products or because of hormonal imbalance. So they are just temporary in use, and also many people face contact dermatitis because of the products which are there in the shampoo. That is, there is super added condition called as contact dermatitis, where there is increased itchiness, increased dryness in the scalp, which will lead into more irritated scalp and production of more amount of hyperproliferation of the epithelium, leading into much amount of larger flakes of dandruff. And topical corticosteroids. See, dandruff is something which is very low-key disease. That is, it is not a disease which is harming your health or which is causing you to go to death. No. Why do you want to use just steroids for such a small problem? And then BHA, which is salicylic acid. Salicylic acid will also strip the natural hair oil from your scalp, making it more dry. So medicated shampoos make it dry, irritated, and also some people have contact dermatitis to the substances present in the medicated shampoo. Taking corticosteroids will not cure the condition, but it is just a temporary relief. And also taking salicylic acid in your shampoos can also make your scalp dry, irritated. Next, coming into the homeopathic part. So why should you choose homeopathy for dandruff? I know people feel like dandruff is just an external cause, or if you change your hair product, you will, your hair will or your scalp will become normal. There is epithelial disruption, and also not only that, there is hormonal change in oily dandruff. Of course, dye dandruff can be treated if you are just changing your hair regimen, but remember, genetic causes can also cause dandruff. Even if you're oiling your hair properly, or even if you're taking your scalp a good hair massage and giving it proper condition, and you're keeping it in good care, then can be dandruff because of genetic cause. Here homeopathy comes into play. If your dandruff is of genetic cause, then homeopathy will can help cure it. And not only that, it is timely and holistic. So what is holistic? That means it is tailor made or custom made just for you. And not only that, it just not gives you symptomatic relief, it will target that immunity problem that you have. For example, because of the epithelial disruption, the hair follicle microenvironment is disrupted. So what will the conventional treatment do? It will just remove that yeast or acne bacteria, but for how long? You are always exposed to it. If you strengthen the immune system near the hair follicle, then that can prevent dandruff. So homeopathy helps not only in symptomatic relief, but also in preventing and curing the dandruff. And also it will improve your scalp health by increasing the microimmunization near your hair follicles. And also individualized treatment, as I already told you, it is tailor made or custom made just for you, just for your concerns. Natural alternative: instead of using synthetic shampoos, homeopathy, which is derived from natural sources, these medications are of natural sources, will help you in healing better and treating your dandruff in a better way. And we do not use any sort of steroids, or we do not use any sort of acids in treating your dandruff. It helps in preventing and giving relief as well as in curing your dandruff by increasing your immunization and also by correcting your genetic factors. Next, coming into the precautionary part of dandruff, what should you do? First, eat a healthy diet, because eating unhealthy can cause changes not only on the skin on your face but also on your scalp. And then wash your hair regularly. Remember to use a very mild shampoo. Don't use anything that you see on YouTube or on Instagram. See if it just fits for your skin. If your skin is oily or your skin is dry, use shampoos according to it. Massage your scalp. Even if you have oily dandruff, remember, oil removes oil. So by just applying a little bit of hot oil and massaging your scalp very gently will help in easing pain and also will help in giving relief. Managing stress. Stress will cause hormonal disruption leading into dandruff. Get some sunlight. As I told you, low amount of zinc, vitamin B, and as well as vitamin D can cause epithelial disruption, or can cause low immunity, or can cause fragile epithelium on your skin. If you're having some good sunlight, then that will help you in managing your dandruff. Limiting hair products. Do not use a ton of hair products to style your hair. Let your hair be natural. Avoid hot water. Yes, this is something that you have to remember. If you're suffering from dyed dandruff, or even if you're suffering from oily one, remember that using a lot of hot water on your scalp will dry your scalp and also will irritate the scalp. So next time you're washing your hair, remember to use lukewarm water instead of a really hot water. Establishing a routine. Have a routine. Oil your scalp once a week, or maybe massage your scalp once a week. Use good shampoo. Just like you're having skin care, have a hair care. Clean your brushes and your combs. This is something that many of the people just don't just take it for granted. See, combs can attract bacteria, fungus, as well as yeast. Because you're combing them and just putting them there, the oil that touches the comb can also attract, or it will help in proliferation of yeast and fungus. So even if you're using brushes or even if you're using combs, please make sure that you clean them on a regular basis for a healthier scalp. Coming into the consultation part of Fidicus. Here at Fidicus, if you're suffering from dandruff, if you have seen our video and you would like to get in touch with us, we have two types of options for you. One is the online option, and then is the offline option. So what is online option and what is offline option? If you're staying far away from the nearest branch of Fidicus, you can contact us through two medias. One is audio consultation, the next one is video consultation. And not only that, we provide you with our highest good rated medicines which will come to your doorstep, or we do home deliveries. Like, for example, if you are in India and you would like to get in touch with us, you have had a doctor consultation, the medicines that we provide will reach you within 3 to 4 days. If you are in USA, it will take 3 to 5 business days. If you are anywhere away from USA or from India, it can take up to 4 to 8 business days. If you are staying nearby the nearest branch of Fidicus, you can come and visit us offline. You can bring your investigations, show us, have a doctor consultation. You can contact us at Fidicus through this number. You can call us or message or WhatsApp us through this number. If you're suffering from dandruff, you've seen this video. You have homeopathy doctors near you or in your street as well. But why do you want to take a chance? Here at Fidicus, we have highest chance of health. That means we follow 3 principles. What are those? The medicines that we give you are top notch, and also the personal care that we give you here, the personal counseling or the nutritional advices we give you here are top notch, and the success rate is really high, and the treatment is very transparent. That means there is no grayish area between the patient and the doctor. We have black and white area where we'll be telling you the treatment options, how we are going to treat you. So next time if you want to opt homeopathy, try Fidicus Homeopathy. Thank you.